Good morning, everyone, and welcome to the Wednesday, April 28th COVID-19 Response Media Briefing. I am Julie Grauert, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Dr. Scott Lindquist, Acting State Health Officer. Lacey Fehrenbach will be joining us shortly, Deputy Secretary for the COVID-19 Response. Dan Laster, Director of the Vaccine Action Command and Coordination System, or VAX Center. And from BloodWorks Northwest, we have Juan Cotto, Senior Government Affairs and Community Engagement Specialist. To begin today's briefing, we will open with remarks from Secretary Shah.
Thank you, Julie. Thank you to my fellow panelists, and thank you to all of you for joining us this morning. I just want to start by a personal and professional note to say that I'm grateful to the Washington legislature, the Washington Senate, led by Senator Cleveland, who confirmed me on Friday as the Secretary of Health for the state of Washington. It is an incredible honor, and I'm humbled by just the discussion as well as the support that not only I've received from Governor Inslee and state government, but also the Washington legislature. In particular, I just want to thank the legislature and the Senate for that confirmation on Friday, and look forward to earning and continuing to earn that trust as we move forward, not just for COVID-19 response, but well beyond. Today's briefing will again focus on COVID. As you know, that we are in the midst of this continued race with vaccinations. We know that our immunity across the state, whether it's because of infections or because of vaccinations, is still not high enough, that we are concerned about a fourth wave, and we absolutely know that the safety and preventive precautions need to continue for a bit longer so that we can continue to fight this pandemic. We also know that vaccinations are working, that it's not just about people getting vaccinated, but also helping their loved ones getting vaccinated. We know that the lifting of the pause of J&J vaccine this last week, as well as the CDC announcement yesterday, is that vaccines really do provide a pathway to getting back to normal. And we want to assure that people are working towards that, getting vaccinated, encouraging loved ones to get vaccinated, or even folks you don't know to get vaccinated, so that we can really get back to normalcy. And obviously we want to make sure everybody is a vaccine champion and an advocate as well. So let me give some additional context to where we are. As you know, every week is progress on vaccines, and that progress on vaccines moves us closer to ending this pandemic. And if I could have the slide come up, we have passed another milestone here in the state of Washington with more than 5 million doses that have been delivered and administered into the arms of Washingtonians, and that includes that 84% of the doses that are coming into the state of Washington are now in the arms of Washingtonians. And so I do think we are continuing to make progress. And as you remember, this has been a climb from where we were in the early part of the year. And I really want to thank all of our partners, and certainly our Department of Health staff and all the individuals that have been involved in making sure that we're working tirelessly to get vaccines to our community members. If I can show the next slide, I think it's also important to show some context here as well in how we've reached our milestones. And this is a graphic that shows you how long it took us to reach the first million doses administered. It was 53 days, and then the next million was half of that. And then, as you can see, we are now making progress, and at getting to the 4th million and the 5th million, it's taking just about 2 weeks for us to reach these milestones. So I think it's really critical that we see that we are continuing to make progress, but we can only make that progress if we have the adequate supply. We do believe we have the capacity across the state, and that's something that we, along with Governor Inslee and his team, have been assuring that we have the capacity across the state to administer the vaccine. And really, it's a matter of supply, and it's also a matter of demand. And we want to make sure that our population, when offered, are getting vaccinated. We've had over 3 million people with at least one dose of COVID vaccine. That represents 40% of our state population, and almost 30% of our state is fully vaccinated. And as I said just a bit ago, we did resume the Johnson & Johnson vaccine this past weekend. While we do not have a significant supply for Johnson & Johnson, we do believe that this is going to mean additional vaccine supply into the state of Washington. And previously, if you recall, we had administered about 169,000, just shy of 170,000 J&J vaccine doses in the state of Washington, and had another 170,000 vaccine doses for J&J that were in the state of Washington, and a forecast of for some thousand, which Michelle Roberts is going to be describing as we get a little bit further along. We now have and continue to have 3 effective vaccines, 3 safe vaccines, and we do want to make sure that our community members are keeping that in mind. If I can show this next slide as well. This is just the reminder, as we've been saying for the last several weeks, of this entire process of vaccinating Washingtonians as quickly and as equitably as possible really rests on the 3-legged stool. And that is, if I could show that, did that come up? Here we go. And that just reminds us of the importance of, again, supply. And unfortunately, the forecast, pretty much the foreseeable forecast appears to be flat. We may have some minor increases here or there, but we are not hearing from our federal partners that we're going to get an additional supply. We also know that, as I mentioned, the logistics and the ability to provide vaccines and the capacity is there in the state of Washington, but it is really about demand as well, making sure that people are getting vaccinated. So if I could move from vaccines now to the concern that we continue to have, and Dr. Lindquist is on, and he can speak about this, as well as Lacey Fehrenbach, related to our roadmap to recovery. Transmission is still increasing, and we're seeing a majority of our counties are seeing rising case counts, and that is of concern to us at the state level, as you can imagine. We have had almost 400,000 confirmed and probable cases of COVID-19 in the state of Washington, and unfortunately over 5,400 deaths. And so while we've made progress on vaccines, and certainly we've slowed this pandemic down, there are concerns about this 4th wave. The case rates are increasing in all age groups except those who are older, above the age of 60. The sharpest increase, as I mentioned last week, are those in the younger populations, youth and young adults. Hospital admission rates are increasing across all age groups as well. Hospitalization rates, and this is something that we wanted to underscore as well. I've asked our team to go back and look at hospitalization rates for those who have been vaccinated versus those who have not been vaccinated. And while we're still running numbers for all age populations as we are able to, we have some information that has come back for those who are over the age of 65. For those persons who are over the age of 65 who are unvaccinated, those individuals are being hospitalized 9.7 times higher than the rates in those who are fully vaccinated or fully protected. So let me repeat, those individuals who are above the age of 65 who are unvaccinated are 9.7 times higher, almost 10 times higher, the rate that we are seeing of hospitalizations for those who are not vaccinated. I think this is really underscores the point of why vaccines work, why vaccinations are important, and why we want to make sure that everybody, including and especially those who are still thinking about it, for those individuals to reminder, don't hesitate, vaccinate, and we want to make sure that people are getting their vaccines. We're also now estimating that 60 to 75% of cases in the state of Washington right now are the B117 variant, which, as you know, spreads more easily and likely increases severity as well. And as I mentioned, we have the Roadmap to Recovery evaluation that's coming up early next week. And obviously, we are watching what is going to be happening, as you all are as well, related to the counties and what's happening within those county jurisdictions. And we're hopeful that we continue to make progress, but we're also concerned that in many counties, we're seeing the increases, as I just mentioned. Even as the need for caution continues, we're seeing the benefits of getting fully vaccinated expand. And this is referring to yesterday's announcement by the CDC, which we believe is welcome news. As the pandemic evolves, we too need to evolve. That means as the science evolves, we too need to evolve. And as we're learning more about vaccines and the vaccine experience across not just the country, not just in our state, but across the globe, we're also learning about what people can do safely. And so there was a really nice graphic, if you did not see it, that the CDC put out of what fully vaccinated people can and can't not do compared to those who are not fully vaccinated. The essentially boiling it down into fully vaccinated people, which means, again, the reminder, 2 weeks after completing their vaccine, either 2-dose vaccine or 1 dose after the J&J vaccine, can gather outside without masks, except in obviously in certain crowded settings and venues. And people who are immunocompromised, we do want to make sure that they are talking to their providers about precautions, even if fully vaccinated. And I think even yesterday there was a comment that was made by Dr. Walensky, the CDC director, and the CDC later clarified that for pregnant women, while the vaccine appears to be safe for pregnant women, we still want to make sure that the pregnant mom or mother or woman is going to be talking to her healthcare provider in order to make the decision on an individual basis about vaccine, on vaccine for her. Unvaccinated people should continue to wear masks outside. And the studies are suggesting that outdoor transmission is rare, but it still can happen. And I think that's the evolving science that I was referring to. As we're learning more about the science, learning more about what the vaccines protect people from, this certainly gives credence to the fact that vaccines are important and also, again, allow people to get back to normalcy. Everyone should continue to wear masks in indoor public places, avoid large indoor gatherings, washing their hands, watching the distance indoors, and getting tested if having symptoms. And certainly, while this update is a great reason to get vaccinated and to take it outside, I do want to emphasize that Governor Inslee, as you remember a couple weeks ago, took it outside, and he did his press briefing from outdoors. He took it outdoors, and it's a reminder just a couple weeks earlier here what he was really reminding all of us to do. And I think we need to be thinking very carefully about this, is that we know the risk is higher when you're indoors. We know the risk is higher when you're in crowds or in gatherings, and we want to recommend and really help people recognize the importance of vaccines and also to take things outside. Reviewing the mask order with these revisions will be necessary, and we're working on that. We're going to update our guidance as soon as possible. We expect that to be coming out relatively soon, so please be on the lookout for that. To get to community immunity, we need to make vaccine choice the easy choice. And as you know, that we talk oftentimes in public health about making health the easy choice and not the hard choice and the default choice. And we really want to hope that we can do a very similar thing with community immunity, where we make vaccine choice the easy choice, and we can build that confidence and also that hope for the future. As the recent CDC guidance change tells us, is that there are more and more things that people can be doing as they work towards getting each other vaccinated, so that we can see more of our community be able to enjoy time with each other. I want to segue to feedback that we've received from members of our community most impacted by COVID-19 through our vaccine implementation collaborative, the VIX. Barriers like limited hours, lack of transportation continue to pose issues. I am glad that Dan Laster is on. Dan is going to be available. He, from our public-private partnership, and there's a significant, huge equity lens in the work that our private partners are working on with us. And, I do think it's important that we talk about some of the challenges, but we also want to highlight some of what's going well. The community messengers and community-run clinics, bringing vaccines to people where they are, and not necessarily asking people to come to where the vaccines are, but trying to get the vaccines to them. And the collaboration between different and all host of different types of partners has been critical to the streamlining of the experience. If you remember, weeks and weeks and weeks ago, we were really talking about why we wanted to have a one-stop shop and be able to improve the experience of Washingtonians, and I believe we have delivered on that. Language assistance and translations has also been increasingly a part of the work that we've been doing, and we're hopeful that we continue to be able to emphasize the importance of the reach out to the BIPOC communities and communities that, including immigrant communities that are otherwise needing assistance with language or translation, and that is absolutely also critical for the work that we do. Overwhelmingly, we're hearing stories of people sharing their personal experiences, their stories, hearing from trusted messengers that will encourage them to get vaccinated. And, I did have the pleasure, I think I mentioned it last week, of going to the Khmer community in South Seattle. And when I was there, meeting an elderly gentleman who was encouraged by a student to come to the vaccine clinic. And that's ultimately how we're going to be able to do this, is by encouraging each other to get vaccinated, and certainly remembering to wear our masks and washing our hands, watching our distance, and certainly getting tested as need be. To help counties identify equity gaps and measure progress, county level race and ethnicity data are available in our data reports and are going to be added to the dashboard this week. We did have a number of conversations over the last couple of days with our local health jurisdiction partners, including a focused, fantastic discussion yesterday with many of our local health partners about the importance of reaching out to communities that have been disproportionately impacted by COVID-19. So let me close by just saying, if you've already gotten your vaccine, fantastic. I hope you will work with us and continue to, I'm going to try to pull this out. It's our Vaccinate WA. You got our badge. We're working on getting some of these materials out to our community members, that it is really important to show pride in getting vaccinated, but also to have a role to play. As I said, be kind, remind, encourage others to get vaccinated. We need to certainly make sure that we're helping others, but we're also practicing safe behaviors, especially as we are getting into a few of the upcoming events and holidays, including Cinco de Mayo. It's coming up next week. We've got Mother's Day, graduations, and certainly Father's Day, and a whole host of other events that are happening after the fact. 4th of July is the one, and Memorial Day and 4th of July are the ones that also come to mind. We know that virtual gatherings are still the safest, but we also recognize that people, as they're getting vaccinated, they want to be out and doing things. And so certainly take it outside, and certainly remember to encourage someone else to get vaccinated as well. So with that, I want to say thank you to all of you. Thank you to our state. Thank you to our community members for everything they're doing. It is still important for us to remember all the precautions. We are making progress both on vaccines as well as fighting this pandemic, but the concern that we do have is this fourth wave. And so we have to continue working together to fight this pandemic on behalf of Washingtonians everywhere. With that, Julie, I'll turn it back to you. Thanks.
And thank you, Dr. Shaw. Next, we will go to Assistant Secretary Michelle Roberts. Michelle?
Well, thank you, Secretary Shaw. And what beautiful spring weather we continue to have here in Washington State to be able to take it outside. So I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. I want to start with some good news, as I usually do, and celebrate our vaccine milestones. As Dr. Shaw mentioned, we've administered more than 5 million doses of COVID-19 vaccine in Washington since mid-December. I think I've shared previously that when we compare this to the work of our universal childhood vaccine program, in that work where we buy, the state purchases and distributes all the vaccines for kids that are 18 and under in our state every year, we distribute about 3 million doses of vaccine. So really incredible that we've done 5 million doses of vaccine since mid-December. More than 3 million people in our state have received at least one dose, and more than 28% of Washingtonians are fully vaccinated. Every day, I have a few graphics to pull up. Every day, nearly 60,000 people on average are getting vaccinated and are getting the COVID-19 vaccine. That's incredible. And our 4 state-led mass vaccination sites continue to do incredible work. Over the past 3 months, they've given out close to 250,000 doses of vaccine. I'm thrilled so many Washingtonians are protecting themselves and getting their loved ones by getting vaccinated. After you get your first dose, don't forget to get your second shot too. It's important to complete the series to ensure that you're fully protected. If you received the Pfizer vaccine, you should get your second dose 3 weeks after your first dose. And for Moderna, your second dose should be administered 4 weeks after your first shot. Across Washington, about 13% of people who received one dose are overdue for their second dose by more than a week. When we're dealing with a 2-dose vaccine, it's normal for a few people to not make it back for their second dose for one reason or another, but we want that number to be as small as possible. When looking at the nationwide data, you may think our numbers are a bit higher than what the CDC reported this week. And they reported out 8% of people across the US have not had their second dose. But the difference is only because of the way the data was analyzed. Here in Washington, we consider people overdue if they've received just one dose of a 2-dose vaccine. Whereas the national numbers were slightly different in the way they were calculated because they're counting people who've completed the series as well. If we did our math that way, we'd be much lower, and our state average would be about 4.5% of people vaccinated are overdue for their second dose. If you need help finding a place to get your second dose or your first dose, visit our vaccine locator website and make your appointment today. We've gotten quite a few questions lately about what people should do if they've misplaced their COVID-19 vaccination cards. The good news is there's a simple solution. You can visit MyIR. The web address is wa.myir.net, which is the state's free and secure online immunization record system. Through the website, you can access your family's official immunization records anytime you need them. Let's talk a little bit about the Johnson & Johnson vaccine as well. As many people know, Saturday, Washington resumed use of the single-shot vaccine after the FDA, CDC, and the Western States Scientific Safety Review Work Group reviewed the data, and they all recommended the vaccine once again be used. We reached out to providers right away to update them on the findings, share information web pages and flyers we've created, and let them know they could start administering the vaccine again. The pause was proof that our safety systems are working. We have 3 vaccines available that are effective and safe. Lastly, our recent vaccine forecast from the federal government shows Washington will receive shipments of all 3 vaccine types next week. In all, we expect to receive just under 400,000 doses of vaccine in our state allocation. This includes more than 200,000 doses of Pfizer vaccine, 150,000 doses of Moderna vaccine, and close to 17,000 doses of the J&J vaccine. After next week, our allocation drops to about 390,000 doses of vaccine, where it remains through mid-May. Before I close, I want to remind you that if you haven't received your COVID-19 vaccine yet, now is a great time to make an appointment. And after you get your first dose, make sure you go back and receive your second shot to fully protect yourself from COVID-19. Thank you.
And thank you, Assistant Secretary Roberts. Our final panelist will be Juan Cotto. Juan?
Good morning, everyone, and thank you so much for inviting me to be a part of this morning. I appreciate the support that we have received from the DOH. And Secretary Shah, welcome to Washington State, and looking forward to you. Congratulations on your confirmation. I want to share with you just the points on a crisis that we are currently having, really not only within Washington State, but really across our entire country. For the last decade, blood donations have been going down. And in Washington State, we reflect that trend. The last year during the pandemic, with people looking for something to do to support their community, we saw an uptick in donations, which really lasted throughout the year. But since February, we've started to notice a precipitous decline in blood donations. And obviously that really leads to some issues in our healthcare system that are really unseen and not discussed until they get to this point. We are in a code red emergency situation right now, and it leads to from a perfect storm from a couple of different areas. Number one, there's still lingering confusion whether you're eligible to donate blood after the vaccination. And I know the state has done such a hard work, and you just spoke about that this morning about getting the vaccinations out. But the other thing that we have been telling people throughout the state of Washington and our community, and that we work with at BloodWorks Northwest, is you can still donate immediately after your vaccination. And if you're interested in doing so, you can go to www.bloodworksnorthwest.org, and we will give you the specifics in regards to donating after vaccination. As Ms. Roberts referenced, the beautiful weather that we've had for the last couple of weeks has led to an increase in cancellations at our centers. And no-shows have been increasing over the last 3 months, but over the last couple of weeks in particular, since the good weather, we've seen almost a 73% show rate, which means about 27% of the people are canceling appointments. Warm weather is typically when donations stop, and we see this a lot during the summer, but with the burden of the pandemic, people are starting to get their lives back, and they should be having opportunities to see family and friends, and start to really enhance opportunities that they have not been able to do for the last year. So we're asking donors to make an appointment to please keep it, and to please be patient. Because of the CDC and FDC guidelines, we have spaced out our appointments in the donor centers to make sure that we have a safe environment for our donors. And what happens is that we have fewer donor slots available. So sometimes it could take up to a week and a half to 2 weeks to find an open spot. But please keep trying, because we can get you in at the donor centers or at specific pop-up area locations where we can get the blood donations. For one 7-day period in mid-April, we experienced record blood usage, transfusions at 118%. So more surgeries are being scheduled. And this is the biggest blood shortage since the pandemic began a year ago. And it's important to understand transfusions are still the #1 medical procedure in most hospitals. So we're seeing an uptick in usage, and that makes our efforts more important to get donors into our centers. For the last 2 weeks, BloodWorks has been down to a 24-hour supply on hand. So it's a really critical moment. We're asking blood donors to make appointments. Please keep them. And also to remind them that blood donation is safe. Donors are asked to please wear a mask. We hit all of the safety protocols, and we practice social distancing at all donor centers and pop-up locations. So these are opportunities for people who are looking to make a difference. And obviously we depend upon the Department of Health in regards to getting information out and supporting us in this effort, as it is so critical to our healthcare system. So I want to say thank you very much to the team at the Department of Health for the work that you continue to help us with. And we look forward to seeing how we can continue to engage our community all throughout Washington State in blood donation. Thank you so much.
And thank you, Juan. We so appreciate you joining us this morning. This brings us to the question and answer segment of today's briefing. We do have quite a few pre-submitted questions today, and we are going to do our best to get to everyone. However, if we are unable to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question comes from Lisa at GeekWire. Lisa?
Thank you. I wanted to ask about the rate of vaccination. The national numbers are showing a kind of plateau and decline in vaccination rates. Have we seen anything like that in Washington? When maybe would you expect to? And are there statewide plans to address hesitancy, or is that going to be targeted more at the local level?
Thanks, Lisa, for that question, and I'll take it and ask Michelle and maybe even Lacey to chime in. So we are, watching very closely vaccine appointments and what's happening across the state. And as you've seen, that there have been reports, and not just in the smaller jurisdictions, but also in some venues in larger jurisdictions where there are appointments that are now seeming to be less demand for. Now, that doesn't mean that there are a number of things that can go into play there. As you remember last week, I had asked individuals across the state of Washington to be kind to remind themselves to cancel appointments if they were already had multiple appointments they were holding. And so maybe people listened, but in all honesty, I do think that there is a concern about vaccine demand, and we want to make sure that we're not just about hesitancy or confidence, but we want to make sure that it's also about ease of access. And we want to make sure the experience of getting a vaccine is as easy for people as possible. Again, making the vaccine choice the easy choice is where we're going with that. When it comes to working with vaccine demand and outreach at the, really working at, I think your question was about state and local, and I think it's not just an either or, it's an and. We are looking at hesitancy and what are the kinds of things that we can do to continue to build the confidence in all three vaccines, but also in the process of vaccinations and why it's critically important. And at the same time, we're also working with our local partners on the ground. And, Juan Cotto is an example of, someone who is on the ground. He just quoted, a 27% reduction of what's happening in his system. And that is an example of why we have to have our ears on the ground of what's happening, working with our local partners. But we do think hesitancy has to be fought at both a federal, national level. It should be at the state level and should be at a local level. So we're working with our community groups. We're also particularly working with our community-based organizations, that they're rooted in the community. We want to make sure that they're also working with us, and we're working with them to give them the support and allow them to be the trusted messengers when obviously there are a lot of people out there that still remain needing to be vaccinated. So I think that's maybe in general. Let me say those comments and then turn it over to Michelle and Lacey if they have some additional things they want to add.
I'll just add that, our demand statewide is really pretty consistent, but like Dr. Shah said, there are just some differences between communities, and really just what we're working to do is make sure we have community-driven messaging and strategies to support people in easy access to the vaccine, bringing the vaccine where people are, and helping answer questions and concerns that people may have about the vaccine. So we have lots of great information on our website to help do that. And really, this is going to depend on all of us. It is going to take all of us to end this pandemic, just like it took all of us to keep flattening the curve and other pieces. But to end it, it's going to take all of us, and we really need to make sure each one of us is vaccinated and talk to your family and friends. And like Dr. Shaw shared earlier, help a neighbor or help a family friend get an appointment or get into an appointment. So that's really the most important thing we can all do.
Thank you, Michelle and Secretary Shaw. Our next question comes from Ariel at the Spokesman Review. Ariel?
Great, thank you. I'm curious if the state is beginning to shift vaccine allocations to where there is more demand. I know that was discussed a couple weeks ago as a possibility, and I'm curious if we're seeing a split between Eastern and Western Washington or more urban and rural areas in that vaccine demand. And then this is a short question also, but I'm curious when that county level race data on vaccinations will be made public. Thank you.
Thanks, Ariel. Let me turn that over to Michelle and Lacey to answer those questions.
Yeah, I can, I'll start, and then Lacey, if there's anything you can add. We are definitely starting to shift vaccine to where the demand is or where provider orders are. So definitely counties share plays a piece in what we're looking at to help prioritize our vaccine orders, but we are going to let no dose go unused. So if providers in any jurisdiction haven't ordered all their doses, we are shifting those to other counties to make sure all doses are used every week. So that is a piece of what is happening. There is differences in our vaccine rates by county. You can see that definitely on our map. And so if you haven't, that's just really quite clear that differences are in our vaccination rates by county. And so that is a concern of ours. And that's why we're continuing to work with our local health jurisdictions, healthcare providers, our community partners, really to identify and drive community solutions to building confidence and making sure vaccine is accessible to everybody in that community. As far as race ethnicity data, that we did add a report to our dashboard on Friday that starts to break down the race and ethnicity data by county. And we're working to get that added to the dashboard as well. Not every county, because of small numbers and privacy, is going to have every category available right now. But as that data increases over time, we'll continue to update that and share as much data as we can.
Thank you, Michelle. Our next question comes from Keith at Coma. Keith?
Yeah, I'd like to hear from Dr. Lindquist and Secretary Shaw on the fact that on Monday, you're going to make a decision on which counties are going to roll back. The state average right now is in phase 2 range, 238 cases and 5.5 on the hospital rate. Should the entire state be rolled back to phase 2? And the other question is, come Monday, the governor actually said the decision will be made Monday, but not released until Tuesday. If you could clarify that. And for Dr. Lindquist, where do we stand on the possibility that some of these might be able to get the wire and roll back?
Keith, you broke up on the last part of the question to Dr. Lindquist. Could you just repeat that? And I'll take the part of the first one and then ask Lacey also to weigh in on that first question. But could you repeat your second question to Dr. Lindquist?
Sure. It has to do with some of the counties. Is there a potential that right now they're already above in the phase 2 territory? Is there a chance that they could drop their numbers and not have to be rolled back to phase 2?
Great, thank you. So let me start with your first question. And right now we have put forth the roadmap to recovery, both the metrics and the schedule and how we're going to go about doing this. We have not had discussions outside of just monitoring, in terms of moving the entire state back, as you were asking. It's really, again, looking at this from a county to county perspective across. And as you know, there's a significant variation across the counties. And certainly we don't want to be premature about what's going to happen on Monday. But again, the concern is that we are seeing increasing transmission in communities across Washington, but not everywhere, but across Washington. The second part of your question was about the Monday, Tuesday timeline. We at the Department of Health felt that as we were looking at our data, we wanted to make sure we had the latest data and we were able to process that data and have the latest data to be able to accurately make decisions. And that's why the Monday timeline to get the latest bit of information that comes in over the weekend allows us to process and analyze that data on Monday and then be able to make based on the metrics recommendations on what's going to be happening with those counties, and then that would be announced on Tuesday. So the clarifying is that we were previously looking at releasing that data on Monday, and now we're releasing that data on Tuesday, so that gives us the latest information on Monday to be able to process and analyze. Lacey, did you want to say something before we turn it over to Scott?
I think you covered most of it. The shift does allow more recent complete data. I think one of Keith's questions, is there still hope for counties? Can they turn it around? Counties will be moved based on their metrics for the time period, the evaluation period. I think, a really important message, and I think we were asked a similar question before our last review cycle, is that it's never late to turn it. It's never too late to turn it around. And if your county moves back or doesn't move forward in this review period next week, there's another one coming up. And our goal here really is this, and this is why we're not moving the whole state back. Our goal really is to keep our state moving forward on a pathway to recovery, that we're dialing up or down the activity based on disease level while we are rapidly vaccinating Washingtonians as equitably as possible, so that hopefully we're all going forward as we move later into May and June. So over to you, Scott.
Yeah, no, Keith, I think they've said it well ahead of me, but just to summarize, the state is not just one unit. There is so much variability across the state. We're trying to respect that. So there are counties that appear to be above the line. They do have time to turn it around, like Lacey said. We'll just have to wait and see. This whole fourth wave business looks to be, and this is a bit premature, but it looks like it's starting to plateau a little bit. The data isn't complete, but that gives me hope that a lot of these counties can turn this data around in the next week.
Thank you. Our next question comes from Tom with Public Radio. Tom.
Hi, thanks for making time for us. I have a follow-up for Michelle and maybe others to come back to the differences between counties on vaccine uptake rates. I was looking at that yesterday, and it really is quite stark, the difference between the leaders like Jefferson and Clallam and the laggards that are at half the statewide rate and 1/3 of Jefferson or Clallam almost. Can you talk a little bit more about whether state resources are going to go into places like Stevens and Ferry and Pend Oreille and Garfield counties that are down at 21% or so?
Yeah, absolutely. We're regularly talking. We talked with the health officer and the administrator in that Northeast Tri-area yesterday, along with many other local health. We're talking to them a few times a week, offering state resources. That area of the state actually has had, we've partnered with them on an incident management team and some leadership to plan as a community around their vaccine rates. And they're doing a lot of incredible work. It It is a hard hill to climb, though. There is a lot of people, and they're in people, and I want to be clear, in every community in our state, we have people who are first in line and ready to be vaccinated, and we have people who either are not confident in the vaccine, need more information, or maybe it's just not super accessible. You know, we have got all the early adapters probably in now, people who are like, give me my appointment, I'm ready to come in. Now we need to do work to bring vaccine to people. There's a lot of people who are ready to be vaccinated, but maybe because of their work schedule or just other things, they're probably not going to go out of their way to get it. And so it's our job to figure out, how do we make it easy? What incentives, what information, who can talk to them about vaccine, what questions and concerns they have. And that's exactly what we're working. So we're partnering on communication and outreach strategies. We're offering mobile teams, all of those pieces, but it's going to take time for us in these communities. And unfortunately, in that area of the state and maybe others, it may be increasing disease or knowing family or friends who now are sick or in the hospital. That's not where we want to be, but sometimes that immediate risk is what is going to drive people if they've maybe been on the fence some more. I do want to say that all areas of our states, our county government and our healthcare providers are doing tremendous work. So they're doing phone calls door to door in that area of the state. They've done a lot of specific mailers and utility bills and a lot of other strategies. So, and we're just going to have to keep it up. We've got a long road ahead of us. And like I said earlier, it is going to take all of us to end this pandemic. It is individual choice. That's part of where we need for all of us to be making the choice to be vaccinated to help us bring it into the pandemic and really bring our economy back to normal.
The other thing, if I can just add, is there is a, this is hot off the presses, the CDC is releasing an MMWR article just this morning, and it should have hit the wire. If you haven't seen it, please look at it. But it's really about real world data showing that vaccination reduced the risk for COVID-19 hospitalization amongst adults 65 years of age and older. And this is based on both Pfizer and Moderna, the 2 doses. What they're showing is that there is a 94% reduction in the risk of being hospitalized if you're 14 or more days after your second dose of either Pfizer or Moderna. That's a 94% reduction, which is in line with what we mentioned earlier about the 9.7 time increase of hospitalization rate based on those who are unvaccinated versus those who are vaccinated in the 65 and older. So again, as Michelle just said, this is, and our team has been talking about that there is time to both to turn things around. It's never too late, but also that vaccines are incredibly important, and we don't want the experience or the confidence to be shattered or somehow impacted by any reason that we can do anything we can on our end. I will say that it is complex, and it is hard to know why in one county or one community you might have more uptake than another county or a community. If we knew the secret sauce exactly, we would be able to, take the exact steps to remedy it. Unfortunately, there is no secret sauce. It depends, and there are a lot of factors that go into that. But we do know that people talking to each other and encouraging each other is a significant driver for people to get vaccinated. And the other is our healthcare providers working with our healthcare system. Doctors and nurses and other healthcare providers doing everything they can to encourage vaccinations across the board is also critically important as we move forward. So just a reminder that, as Michelle just said, it's going to take all of us to not just end the pandemic, but to get vaccinated. And certainly we need to work together on that.
Thank you. We have a question now for Juan. Juan, what ideas do you have to engage blood donors?
First of all, the conversation is so interesting around the vaccines because it's such a similar thing in terms of engaging the public. And I just want to say thanks to Lacey and her team for early on when we communicated back in December. I just want Dr. Shaw to know how unbelievable responsive they were in making sure that blood centers and blood donation workers, our phlebotomists, were seen as essential employees for the vaccine. And I believe most of our staff was vaccinated in the month of January, which was a very big help to us. And we gladly participated in vaccinations to make sure that we had a safe and reliable blood supply. It's the same thing. In the state of Washington, what we've seen, for example, from the train disaster back in 2017 down near Olympia, when there is a concern in the community, the citizens of the state of Washington respond. There were people lined up around the block at donor centers, at Bloodworks Northwest and other locations to donate blood. So when there's an emergency, when people understand that there are cancer patients who don't have platelets at Children's Hospital, and the kids who are receiving chemotherapy, which eradicates the platelets, which are the clotting element of blood, people respond to that. So it really is getting the important message of the impact that blood donation has. And when we do that, we see that the community responds. And that's part of it's our responsibility to do that as blood centers, but we can always use the help from our elected officials, and Governor Inslee does a great job. He and Mrs. Inslee are blood donors, but they also speak to the importance of that impact that it has in communities to get people to donate blood.
Thank you so much. We have 3 reporters left just for your awareness. Our next question comes from Nicole with Cairo Radio. Nicole?
Good morning. Thank you so much for taking my question. So if herd immunity is about 70%, but children can't yet get the vaccine, what percentage of people over 16 would realistically need to get vaccinated in our state? And as a state, can we get there despite some of these lack of access issues and vaccine hesitancy?
Yeah, Michelle and Lacey and Scott are probably closer on this one, and so let me turn it over to them. But I do want to just thank you, Nicole, for that question. Just a reminder that we do expect, we anticipate that the 12 to 15-year-olds will become eligible sooner. And as you know, the trials are now for younger populations, 6 months of age and older. So that will likely be later, but we do anticipate in a matter of weeks to a couple months that we should be able to get the 12 to 15-year-olds, which will also increase the number of people that are eligible. So our team, anybody wants to take that?
I can start. So it's a great point. And yes, that does mean that initially early on, we need as many adults who are eligible to get vaccinated as quickly as possible. That is our path out of this. In the meantime, we have other tools in our toolbox that help us slow the spread and can protect, those who cannot be vaccinated, including children who are not yet eligible. Those are things like wearing our masks, watching our distance, keeping our social circles small. These are like the 2, last week I talked about it as offense and defensive strategies we have to get through this as quickly as possible. And when our disease rates are low, we also are protecting those young people until their vaccine becomes available to them and ensuring that they have the opportunity to be fully in person in school. So we really do hope that adults will come together and help us get to that community immunity level. And Scott can share more on the actual level or percent or what we're aiming for, but it's not a hard number. And it's going to take all of these strategies. And the other thing I wanted to share when someone asked a question about confidence, if you've been vaccinated and you know people that are on the fence, talk to them, give them your why, be willing to answer their questions. If you do not have the answer, point them to trusted sources like the DOH website or CDC website or their healthcare provider. These are the things that help people on the continuum of making a behavior change and choosing to be vaccinated.
Thank you, Lacey. Our next question comes from Jen with the Seattle Times. Oh,
really,
Scott?
Yeah,
Sorry,
Scott.
I didn't. Okay,
Okay.
go ahead, Scott. Pardon me.
Yeah, no, you're okay. Lacey said it well. You know, the real answer here is it is becoming harder to reach that community immunity with all the things that we're talking about that you asked about in the question. But what I'd like to really just summarize what Lacey said is this shot is not about you. It is about your community and what we can do to protect the community, meaning those people in the community like kids or those that can't receive the vaccine. I personally got the vaccine, not just for myself. While there is personal protection, it protects my family, it protects my friends, and it protects my patients. So that is the real shift that needs to happen here. We need to start thinking of what's best for the community. Lacey laid it out very well. There are models around what percent of Washington state needs to be vaccinated to reach around 66% or 70%, which is thought to be the level of vaccination needed to interrupt transmission. And you can, I don't have those numbers in front of me right now, we can send those to you, but those have been modeled taking out those who are kids or less than 12 years of age. So we can get that to you, but yes, it is increased. I off the top of my head, I remember the number was in excess of 80% of the eligible population needs to be vaccinated. But again, I'll reiterate, it's not about you, it's about the community at this point. Thanks.
Thank you. Our next question comes from Jen with the Seattle Times. Jen? Stand by. I am working to unmute Jen. There we go. Jen?
Oops, am I here?
Yes, you are.
Awesome, thank you. Good morning and congratulations on your confirmation, Dr. Shah. We're wondering if you agree with the CDC guidance on masks. We've talked to some folks who say it's kind of complex and it muddies the waters. Is that your take on it, or what would you say to those folks and to Washingtonians who are just wondering whether or not they should mask up outdoors?
Yeah, you know, first of all, thank you for the the shout out and I appreciate it. I do think, you know, I said this maybe about 6 weeks ago, a couple months back, where the initial guidance that CDC was putting out there around vaccines and what people could do was a 1.0. And this is, if you could, you know, maybe this is a kind of the beginning of a 2.0. And I would think that there's going to be a 3.0 and a 4.0 and a 5.0. This is a constant updating on things. And I think the key message, and all of us know this, look, people around Washington are smart enough to know this, that when you're around people and you're not vaccinated, and especially if you're around people indoors or in a crowded environment, that the risk goes up. We know that. This is not magic. This is just, it's common sense. It's that when at the same time, if you're out and no one is around and you're out and about and people are, you know, there's no one around, I always say to my family, just keep your mask with you. Just have it on your neck. Just have it somewhere so you've got it and you can just pull it up when somebody comes by you. Otherwise, don't be in a situation where you are caught off guard when somebody is walking by, or there's a concern about whether that person's vaccinated or not. So I think that it's just really about common sense. And I do think this is the first step towards getting there, getting to where we believe we need to be as a nation, but we still don't have enough people vaccinated. I think that's the issue. If we had already, you know, as a nation vaccinated 70% of our people, and you know, we were seeing no concern about fourth waves anywhere in the country, it'd be a different conversation. But right now the conversation is we're seeing data going in a certain direction. Hopefully, as Dr. Lindquist mentioned, it's flattening in our state. And at the same time, we're also seeing that masks are increasingly, people are recognizing the common sense nature of how to utilize them, especially if they're vaccinated. And I think it's just a reminder of why we have to keep pushing the message around vaccines. And I know that people get sometimes disturbed when all the health people talk about vaccines, but that's 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 what we as a nation and as a globe have asked for all this 18 I guess it's 16 months away out of this pandemic. And here is the pathway out of this pandemic. And now people are shying away from it. And that is really concerning to all of us in public health and beyond. And so whatever we can do to do this together, I think that's the key message. But I do think this is an additional step that the CDC has taken. I think it's welcome. I do think that there is going to be additional vaccine experience we're going to learn. And then you are going to see additional steps that will be coming through and guidance that's going to come from the CDC. And again, we'll look at that. We'll take a look at it, make sure we're in agreement with it. We are, and then we move forward with sharing that with our communities.
Thank you. And our final question comes from Ben from the Lund Report, and I'll be asking it on his behalf. He wants to know, how much genome testing is Washington State doing for variant strains? And are there any plans to increase the level of testing?
Yeah, that's a Dr. Lindquist question, but he's in the dark right now. I don't know what happened to his light, but I think he's still there. Scott, are you there?
I am here. Are you not seeing me on the camera?
Okay, we see you. You're just a little bit darker. I think your ring light went off.
Okay. Yeah, it is a great question. We are probably one of the most aggressive states for doing genotyping. For this last month, I believe we did 17% of all the positives. We are absolutely way ahead of the rest of the country on our genotyping. And that will continue. So the total since the very beginning, about 1% is the national average. We're, since the very beginning, at a total of 4%. But we have been ramping up the last 2 months to be up to 17% last month. So that's the real answer. We are there. We are at the cutting edge of this.
Thanks, Scott. Before we close out, Dan, did you have anything you wanted to say? I know you've been working hard on the public-private partnership, including on the equity work.
Yeah, thanks. And congratulations, Secretary Shah. Yeah, I think others have said it well, but I want to end with 3 C's. The first is convenience. And, you've heard a lot about it, but we're really focusing on that. And that relates to equity. And that's where, for instance, our vaccine locator tool, working with providers, we're going to be surfacing information about what sites are accessible to which Washingtonians. Convenience is also about ease of access to sites, and that's transportation. And we're really excited, whether it be Sound Transit, Pierce Transit, we're working with other transportation methods. We need to make it convenient. The second C is care. You've heard a lot about it, and the criticality, and for every person, it's going to be different, but it really is caring for all of Washington, whether it's caring for your neighbor, it's caring for your child, it's caring for someone who is immune compromised. But that caring, that's the second C. And the third is creativity. And that's where it's exciting working with the private sector. And I see it in our public sector partners. We need to be creative in thinking about where people are and what makes a difference to them to help be a part of getting all of Washington back to health. And it's the health in our economy, our jobs, our livelihoods, going to church, going to school, in person, all of that. So it's those 3 C's. And I see it, and I'm really excited about the outpouring, the extraordinary partnerships we've had, and even now are having. But so that's what I would say. It's about convenience, it's about caring and creativity. We're going to need it all. I worked at PATH, where we were looking at the last mile. How did we reach people in, out the dirt road, the dirt path? How do you get the vaccine there? We in Washington, and I see it across the United States, we have a long last mile, and it's going to take a lot of work, but we're going to get there. And I'm hopeful, and I really appreciate our private sector partners and all their volunteer efforts that are helping the vaccine ecosystem of Washington. So, thanks.
Thanks, Dan. I would just add the 4th C of connectedness, and just making sure that we're all connected together. So thank you for that. Thank you for your leadership in the VAC Center, and I want to thank Michelle, Lacey, Scott, and especially Juan for joining today. It's been a pleasure and honor. Again, I'm glad this is my first press briefing as now a confirmed secretary, and I am looking forward to continuing to work on behalf of all of Washingtonians throughout the state, wherever you may live. And let me just close by saying again, just the reminder of the importance of vaccinations, the reminder of the importance of those measures individually and collectively so we can prevent this fourth wave from taking off. And finally, let's just continue to work together. If you have ideas, please share it with us. And one thing we forgot to do was to just share the phone number, our COVID for vaccines. You can go on our vaccine locator web tool, but 1-800-525-0127, 1-800-525-0127. And if you can certainly make sure to get that information. Thank you. All right. I love it. That's great, Julie. You guys are on it. 1-800-525-0127. The good news is that I didn't say the number wrong. So I think that's also good by going by memory. And with that, I just want to say thank you. We will get through this. It's going to take us, again, time, but we're making progress. We just have to continue to hang on. Thank you all. Julie, we'll turn it to you to, oh, Scott, you got something?
Yeah, I wanted to update. So I was just checking the variant report. It wasn't 17% in the month of March. It was 13%. Just, I know it's a minor difference, but I just want to make sure when people read the report, they see that. It's 13%, which is still very, very high. But anyways, just a clarification. Thanks.
Thanks, Scott. Thanks for clarifying. And, you know, obviously we want to be as accurate as possible. So appreciate that. So Julie, we'll turn it to you.
We do. Thank you for that clarification. And thank you to all of our panelists, especially guest panelist Juan Cotto, for your time today, as well as to TVW for hosting today's live stream and archives of past briefings. That concludes today's media availability. Thanks again and have a super day.